Hey everyone, Current ECG here. My name's Dave Klein and I'll be your tour guide for the next couple of minutes or so. And by the end of this episode, I hope to have you all literally depolarizing right out of your seats.
I don't know. I've got the 1987 invoice right here, and I can't make heads or tails of this. Look, that's all I have are papers. All that's it. All right, I know. I'll call you back.
Bare aspirin can save your life. If taken at the first sign of a heart attack, bare aspirin can improve your chances of survival and protect your heart from permanent damage. Starting a daily regimen may regulate your blood, prevent clotting, and reduce the chance of a future heart attack. It's up to you. One pill. That's all it takes. Saving your own life is within your reach. Bare aspirin. It's a bear to open.
All kidding aside, aspirin. 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 Give the patient aspirin. Unless there's some major contraindication. If you think your patient's suffering from cardiac ischemia or acute coronary syndrome, give them the aspirin. Aspirin is perhaps one of the most important medications we carry in emergency medicine. Please give them the aspirin. It could save their life. Now, to try to drive that point home a little bit, let's talk about a couple of facts. One is there's something called the number needed to treat. So the number needed to treat means how many patients do you need to give a particular medication to save one person's life directly from that medication. So to give you an idea, Crestor, that's used to treat hyperlipidemia. Crestor has a number needed to treat of 1 in 1,000. So for every 1,000 people taking Crestor, one person's life will be directly saved from taking the Crestor. Aspirin? 42. Give them the aspirin. Now, we also try and look at things in terms of medicine with respect to morbidity and mortality. How do medications increase your chance of survival? Well, if we look at a study here, they quote that aspirin gives you a 23% reduction in mortality, and fibrinolytics, meaning TNK, 18%. So there's many pre-hospital providers that provide TNK. It's a clot buster for patients suffering from acute coronary occlusion, and it does work fairly well. But people forget the fact that aspirin will save your life. So aspirin reduces your chance of mortality by 23% in this particular study, and TNK 18%. So please give them the aspirin. Now, I'm going to tell you a bit of a funny story, and it is just a funny story to drive home the point about aspirin. Please don't do this in your real practice. Ready for the story? Okay, now into non-real world. Let's say you're a paramedic. You're with your partner, you get called for chest pain or bilateral arm pain. And of course, you're like, ooh, this could be acute coronary syndrome. So once you get in the house and you assess the history presenting illness, the patient presentation, and they fit for ACS, you're doing your assessment, and you turn to your partner because you're the primary on the call, and you say, partner, please give me 2 81 milligram aspirin. They're going to hand you the aspirin. You're going to hand them to the patient. You're going to say, Mr. Jones, can you please chew up this aspirin? Don't swallow it. Chew it up until it's like a fine paste. Because the hope is that the aspirin is going to be absorbed through their mucous membranes. The next thing you're going to do is you're going to say to your partner, can you please give me 2 more aspirin? And they're going to look at you oddly, and they're going to hand you 2 more aspirin. And what you're going to do is you're going to go over and you're going to jam the aspirin right in the dog dish. And then you're going to say to your partner, partner, can you get on the radio and please call a supervisor? I would like you to tell the supervisor to please bring me in 2 more aspirin. Please tell the supervisor to come lights and sirens. Supervisor's going to be arriving there. They're going to come in the house. They're going to look at you oddly. They're going to hand you over the 2 aspirin. You're going to take those aspirin. You're going to turn to your partner and you're going to say, partner, can you please take this aspirin? I'd like you to chew it up and make it into a fine paste. The next thing you're going to do is you're going to say to your supervisor, supervisor, can you please go out to your truck or your SUI or your SUV and grab me 2 more aspirin? They're going to look at you strangely. They're going to go out, get you the aspirin. They're going to bring them back and hand them to you. You're going to leave the patient, your partner, the supervisor, and anyone else who's there in the living room where the patient is located, and you're going to walk into the kitchen. You're going to start rifling through the drawers looking for the utensils. You're going to find 2 spoons. You're going to take 2 spoons. You're going to put the aspirin in the middle. You're going to put those spoons together, grind them up until the aspirin becomes a fine powder. Then you're going to walk out of the kitchen, carefully balancing the spoon with that ASA powder on it. And you're going to walk by the patient, your supervisor, and your partner, and into the living room, and you're going to head toward the fish tank. And then you're going to very gently drizzle the powdered ASA in the fish tank. Because everybody gets aspirin. Have I made myself clear? Aspirin. 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 Please give your patients aspirin unless there's a contraindication to it. Aspirin may be one of the most important medications we carry in emergency medicine. And until next time, sugar water oxygen to survive. The eyes can't see what the mind doesn't know. And in Klein's world, who gets an ECG? Almost everybody. Hey everyone, thanks for being a part of today's episode. If you'd like to continue your learning, improve your skills, and provide a higher level of patient care, well, come be part of our community. If you're a student who wants to break through in emergency medicine, learn how to work the trucks in the streets, well, this is for you. If you're a seasoned veteran who's like, hey, I need to brush up on my skills, technology's moving forward, so should we, then this is for you. Come join this community at currentecg.com. Let's make emergency medicine education and ECG interpretation a little less scary and a little more fun. Again, subscribe to us at currentecg.com. Hope to see you soon. Stay current.